Question 1. Obstruction of inferior vena cava presents A. Paraumbilical dilatation, B. Thoracoepigastric dilatation, C. Esophagus varices, D. Hemorrhoids. The correct answer is A. Paraumbilical dilatation and B. Thoracoepigastric dilatation. Question 2. The right suprarenal vein drains into the A. Inferior vena cava, B. Right renal vein, C. Right gonadal vein, D. Left renal vein. The correct answer is A. Inferior vena cava. Left testicular ovarian or suprarenal vein, they usually drain into the left renal vein. Question number 3. True about the anatomy of great saphenous vein. A. Starts as a continuation of medial marginal vein. B. Ends of femoral vein 2.5 cm below the inguinal ligament. C. There are 2 to 5 valves below the knee. D. Ascends 2.5 to 3 cm behind tibial malleolus. The correct answer is A. Starts as a continuation of medial marginal vein. Question number 4. Lymphatic drainage of cervix is to A. Iliac lymph nodes, B. Para-aortic lymph nodes, C. Superficial inguinal lymph nodes, Deep inguinal lymph nodes. The correct answer is A. Iliac lymph nodes. Question number 5. The thoracic duct crosses from the right to the left at the level of A. T12 vertebra, B. T6 vertebra, C. T5 vertebra, D. T2 vertebra. The correct answer is C. T5 vertebra. Question number 6. Which of the following prevents hyperextension of thigh? A. Ischiofemoral ligament, B. Iliofemoral ligament, C. Patellofemoral ligament, D. Puboischial ligament. The correct answer is B. Iliofemoral ligament. Question number 7. Deltoid ligament is attached to all except A. Medial malleolus, B. Medial cuneiform, C. Spring ligament, D. Sustentaculum tali. The correct answer is B. Medial cuneiform. Question number 8. Ansa nephroni is lined by A. Columnar epithelium, B. Squamous epithelium, C. Cuboidal and columnar epithelium, D. Stratified squamous epithelium. The correct answer is B. Squamous epithelium. Question number 9. Auerbachs plexus is present in the A. Colon, B. Esophagus, C. Stomach, D. All of the above. The correct answer is D. All of the above. Question number 10. Intercalated disc is present in A. Cardiac muscle, B. Smooth muscle, C. Skeletal muscle, D. All. The correct answer is A. Cardiac muscle.